This week's Focus on Your Health, Teresa Snow tells us how doctors were able to get him growing once again.
Focus on Your Health is sponsored by MU Healthcare.
Between the ages of 4 and 10, most kids grow about 2 inches a year. But for Spencer Bayman, that wasn't the case.
All in on three. 1, 2, 3, all in!
For 11-year-old Spencer Bayman, baseball is more than a sport, it's a passion.
My goal is to play college baseball.
It's a big goal for a player who was once the smallest guy on the field.
I want to be as tall as these kids. How am I going to achieve my goals by being this short? Why am I not growing?
Let's go, Spencer! Come on, Spencer!
At first, the Baymans thought Spencer was just small, but they soon realized something wasn't right.
It really set in one year coming out of winter into spring when he got out his cleats for spring baseball and he put them on, they fit. And they never should have fit. Those were from the spring prior.
Put your feet together. There we go.
That's when Spencer met Dr. Bert Bachrach, the chief of pediatric endocrinology at University of Missouri Healthcare. After a number of tests, Dr. Bachrach determined a growth hormone deficiency was causing Spencer's growth failure.
He looks totally different. His cheeks are a lot thinner. Growth hormone just doesn't affect your growth. It affects your muscle mass and fat distribution, so that affects your cholesterol, that affects your overall, it also affects your overall sense of well-being.
Ready? Yeah.
Every day, Spencer receives a growth hormone injection. The daily shots aren't exactly fun, but they're working.
2 Mississippi.
Since starting treatment less than 2 years ago, Spencer has grown about 6 inches. The added height has boosted his confidence, but there's a reminder written in each of his baseball caps, too.
It says HDMH, which means height doesn't measure heart.
And heart is something he's got plenty of. Joining me now is Dr. Bert Bachrach, the chief of pediatric endocrinology at MU Healthcare. Can you tell us more about what causes hormone growth deficiency?
Yeah, oftentimes it could be genetic, it could be inherited, it could be traumatic like a concussion, or it could be due to things like low blood sugar or low oxygen levels.
How do you evaluate children for this problem?
Well, we have them followed along a growth curve, and we often plot the parents' mid-parental height. We'll do a set of a laboratory evaluation, and we'll kind of follow them over time.
You're a specialist here at the Academic Health Center. Is this where parents would start, or would they see a different type of doctor first?
And that's a good question. I would have them start with their primary care provider. It's making sure they ask the right questions, because sometimes patients can be growing at a normal growth velocity, but still there's a concern with their growth. And so they need to ask things like, what's the mid-parental height? How's the growth velocity? And things like that. But still, if there's concerns, we're certainly there to answer questions.
It can be too late if you wait to get help.
That is true. So if you wait till late into puberty, then you may not be able to intervene or determine the cause.
What's the future for someone like Spencer, who reacted so well to this therapy?
It's excellent. He's going to have an excellent prognosis. He's responded quite well at this time, and we look to a bright future for him.
It's a good story. Thank you very much, Dr. Bert Bachrach. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.